It's another Saturday when we'll bring you your program Security Watch Africa. Like always, the new season, the new normal is the face mask. We must always put on your face mask so as to protect yourself and your loved ones. It's not a fashion statement really, and though some people still refuse to put on this face mask, it's important. We must abide by that protocol. So for ourselves or even for our loved ones, it's very, very important. My name still remains Patrick Abambo, and it's only on this channel, the African Independent Television, you get that information you need to keep your life safe and secured. Welcome to the program today. Today, we'll be looking, going back. For some weeks, we have not seriously looked into it, and it's talking about coronavirus. Today, we'll be looking at coronavirus once again because some people thought this virus had left Nigeria or left the world, but I think it's back even stronger than it used to be. So there's need for us to look into it. But first, because Nigeria still today, as we talk, still battle issues of terrorism and insurgency. So we can't take our eyes off what is happening in terms of that. Because if that can be able to, we can handle it effectively and we don't have our resources being deployed to fight these terrorists and bandits and all that, those resources could be used for other social development and other medical assistance to the citizens. So we must always look at what is happening when we talk about terrorism and insurgency. Shuli Daniels, all the way in Biu, Borno State right now, put a report together for us on what is happening in that as we sit back as we bring you this report.
In line with its policy of boosting relationship between the communities and Nigerian Army, the Chief of Army Staff, Lieutenant General Tukoyusu Buratai, led his officers to visit the Emir of Biu in Borno State. The Chief of Army Staff was received at the palace by the Emir, Mir Mustafa Omar Mustafa, in company of his chiefs. While receiving his visitors, the Emir, who spoke through his spokesperson, Barrister Ibrahim Shehu, thanked the Chief of Army Staff and the Nigerian Army for restoring peace and bringing development to the Emirate.
Ours is to continuously thank you for a lot of things that you have done to our society, for identifying with our society, and to encourage us to feel comfortable in this society. We do appreciate that. We do, and humbly do, and respectfully do appreciate your kindest gesture. To us, you have been an ambassador of our society. We shall cherish that to the end of our life, to the end of the life of this society.
General Buratai appreciated the Emir and his council for their cooperation to the Nigerian Army and pledged that the Nigerian Army will always work to provide security for the people.
I'm here on my normal operational visit to Operation Lafia Dole, and we've been here for quite some days, and I felt since I'm here within the view, I said, let me come and pay you this homage. The support you've been providing has been quite tremendous, and I'm here to further solicit for the continued support of the person and in fact the entire good people of the Emirate. The Nigerian Army is very much alive to its responsibility, and we will continue to make sure that the insecurity we are facing are addressed. It's a very complex situation, it's a fluid situation, but I assure you we will do our best, and with your full support and the support of the people, we will do our best to reduce and, if possible, inshallah, to eliminate the threat we've been facing, especially from the Boko Haram terrorists.
The visit, which is part of the Nigerian Army Hemsman operational tour to the northeast, offered him the opportunity to lead his officers and field commanders to some of the Boko Haram and Islamic State in West African province, ISWAP terrorist enclave in Borno and Yobe states. This action by Lieutenant General T.Y. Buratai is viewed by many officers and soldiers in the front line as a motivating factor, which has led to the many successes recorded in the fight against terrorism and insurgency in Nigeria. Shirley Daniels, reporting for Security Watch Africa, Bio, Borno State.
Welcome back. Yes, we're going straight to our topic of today. We're asking a question: how severe is the COVID-19 second wave? Already with me in the studio are two gentlemen. One is already familiar. You are familiar with him. But let me start with the newcomer to this discussion today. Is on my far left. That is talking about Comrade Shanabu Abubakar. He's the chairman of Medical and Health Workers Union of Nigeria, FCT Council. It's a pleasure to have you. And he's also a medical technician. So they are the ones that do the laboratory measurement and everything. So we'll be finding out why is it that people are scared to do the COVID test. We'll be talking with you on that. Yes, okay, to the familiar face, our regular consultant on when issues on COVID-19. He has been with us for almost a year now, looking at what is happening. I'm talking about Dr. Kanebi Emeka. Yeah, Fred Hillary. He's a lead strategist of Innovate Health Plus, and he's a medical doctor. It's a pleasure to have you.
Thank you.
So we have the complete medical team here. But let's listen and watch this intro put together by Peggy Agbe.
Coronavirus, which is also known as COVID-19 pandemic, is an ongoing virus ravaging the world, with variable symptoms ranging from none to extremely severe illness. The virus, which was first identified in December 2019 in Wuhan, China, was declared a public health emergency of international concern in January 2020 and a pandemic in March 2020 by the World Health Organization. The COVID-19 pandemic has necessitated global, social, and economic breakdown. It has also led to cancellation and postponement of events, food shortage, educational institutions have been partially or totally closed. The world's economy is in shambles. Even the strongest of countries are on their knees as we all battle this deadly virus with uncertainties for the future. As of 22nd January 2021, more than 98.2 million cases have been confirmed globally, with more than 2.1 million deaths attributed to the coronavirus pandemic. There were certainly hopes of a COVID-free year in 2021, but scientists have drawn our attention to a possible second wave of the virus, which is obviously happening right now, with more resistance and possible transmission, which will possibly override the vaccines due to non-availability to reach nations all over the world timely. Some nations are introducing a second or third lockdown with more measures to curb the spread. Coronavirus COVID-19 pandemic is real. Whether or not we believe, it is then necessary to carry out at all times to the latter the etiquettes outlined by the World Health Organization and various national disease control agencies to prevent the spread, for every life matters. There are questions that agitate the mind. 1. Will the current vaccines developed be able to take care of the more severe and easily transmittable second strands? 2. Are these vaccines programmed to reduce the population of the world as some people are suggesting? These and many more other questions, Security Watch Africa seeks answers from experts. Peggy Agbe, Security Watch Africa, Abuja.
Yeah, welcome. I think already the reporter is helping me with the questions. And I'm going to go straight with you, Comrade Shanabu. The question is this. One, is this COVID-19, is it real? Is it something that we should be worried about, or is it just one of those sicknesses?
Okay, thank you, sir. I sincerely want to appreciate you for that questions. Actually, COVID-19 is real, because if you look at the system today, like in the past years, we have not been experiencing these type of things. Right from 2020 to now, when COVID-19 came, you discovered that the death of age of 60 to 65 and above is so alarming. If you go to the hospitals today, you will discover that people are suffering of this COVID-19. And it's so alarming. So it's real.
Okay. Yeah, I'm particularly interested with you because I know that you are in one of the isolation centers, so you see it real.
Yeah.
How is it in those isolation centers?
Yes, like where I work in the hospital, you discover that even right now in the ward, the isolated center, we have about 45 patients as of now. And for the past 3 days, people have been dying. Almost every day, people are dying. People are dying. And once people who are not in that area, as soon as you discover that people are coming with their dress, and even the way the dead person is being dressed, you know that that's COVID-19. And we advise that people should stay away from all this area, because if you are not in that area, by the time you perceive the odor or the system, it will affect you.
Okay. All right. Now, let me come to you. For close to 1 year, we have been carrying out these issues, and we have been hoping that the vaccine will come to help the world, and the vaccine is here. And just at the outbreak of the vaccine, second strand, second wave came up, and like the question asks, will this vaccine be able to take care of the second strand, second wave that they're saying that is even more transmittable?
So, well, thankfully, the vaccines that have been developed by Pfizer, AstraZeneca, they're seeing that there might be some immunity derived from the current new vaccine to the new strain of COVID-19. About the second wave, basically the increase in numbers that we're all seeing, inclusive Nigeria being part of those nations where we're seeing this rise. Again, like I always emphasize here, there are a lot of factors involved looking at the rise. The very glaring one is the festive seasons that just happened. A lot of people just let down their guards. I must enjoy Christmas. I must enjoy the New Year. So you just see in a lot of places these protocols, which were, greatly held on to months ago, you know how it was, are gradually just being, taken casually. That's the problem. That, just this thing, it's like, it'll just come and go, or it won't happen to me. But I also see another group of people who are taking this now more seriously. And you know why? Compared to before, a lot more people now know people closer to them
exactly
who have been tested positive.
And it's even also younger people are dying, 22 years and all that.
Yeah, so we're seeing people closer, particularly, I just tell people that now it's closer. You know somebody, you have a cousin, somebody, you have a sister who has been infected by the virus. So now it's more real. So talking about how real it is more real to everyone. So everyone now is just saying, it can't happen to me. That attitude that people put up, it can't happen to me. And that's what's responsible for this. Number two, remember that over then, there were restrictions on a lot of things. Travel, there was even a restriction of movement. But now those things are kind of lifted. People go in and out. The numbers of places that used to test for COVID-19 now are more. Yes. Initially in Abuja, there were just 4 registered places that you could get a COVID-19 test, but now there's several. What happens with that? You now have a lot of people now trying to get the test not at the right time, trying to get the test illegally just because they want to travel. So they're going to travel, they're going to spread, they're going to come back in, they're going to spread. So a lot of the things that used to be like barriers are being eventually just let down.
I'm scared because what you're saying now means that there may be temptation for a second lockdown. Yes. People must control this.
I hope that doesn't happen, because economies like Nigeria, like people have predicted, economists have predicted,
will crumble,
will just fall and collapse.
Okay. I just hope and pray it won't happen. Let me come to you, comrade. Yes, because the health workers, in fact, he's a medical director, a medical doctor here in Abuja, so he's under your council too. So how secure? Because first, I think those people need to be secure. Some people have argued this, that when the vaccine comes, we're expecting it maybe in 1 month in Nigeria, that the health workers must first be vaccinated before the people. But before we take that, some people are even say we should not even take the vaccine. It's a way to reduce our population. Is that true?
Yeah. Some clergymen are preaching that, especially the imams and the pastors are preaching that it's going to reduce the population. But first thing as soon as this vaccine arrives, there's need for education
Yeah.
to sensitize people the effects and the advantage of that, so that people will be enlightened before taking the vaccine. If it's so, people will be encouraged to go for vaccine so that to reduce this coronavirus pandemic. It will reduce that. But once people are not educated, once people are not aware, when the awareness is not created to their brain, then people will just overlook it. And like what my colleagues have just said, before you travel, when this thing came in 2020, before people travel, they will say, okay, there should be a social distancing in the vehicle. But today, people are jam-packed. People are jam-packed in the vehicle, and it is not good.
It's not good.
Yes, and they look at the rate of crowd. Look at the COVID-19 rule says 50 people and with a distance. But today you see people gather over thousands.
Some people are having crusades,
crusades,
lots of things, and weddings.
It's
Yes.
amazing.
So
Weddings, nightclubs are functioning.
So there is
It's
need for
just
people to be
amazing.
educated, to be aware, to
Okay.
create awareness to people, even to the community.
Okay, but my second question: how secure or safe are your union members?
Well, my union members, right from the inception, we have been educating them that once before you take any sample of a patient, it should be protected.
Okay.
And as soon as they are protected, you believe that the patient equally protected, and that infection will not come to you. So we have been educating.
But my fear is, let me come to you because you also practice, you also carry out all these tests. My fear is that the stages, the layers, a patient walks in with malaria or whatever, he meets the nurse, takes the vitals,
The whole
goes to
clinic
whole
flow.
clinic row, goes
The
to the
whole
doctor,
clinic
goes to the
flow,
lab
yeah.
and everybody until sometime you now find out, oh, this could be COVID-19. You know, how safe are these medical personnel themselves?
I think that's a very good question. I think that they are I have to include myself. We are the ones in the front line. You know, our technicians, our medical laboratory scientists, the nurses, the doctors, even the cleaners in the hospital. We are the ones at the very front of this tragedy. And so that is why it's very important that all the preventative protocols put down must be adhered to. You know, it's just basic. That's just basic, infection prevention control 101. That if whatever it is, whether this was not COVID, there are just strict guidelines before you touch another client. What do you have to do? You need to wash your hands. It's just normal protocol. Wash your hands, dry your hands. That's infection prevention. The windows in the facility need to be open for good ventilation.
Okay.
These are standards, crowding, having doors opened. They're just standards. So if those things are not put in place, if those things are not followed, then their risk increases. Everyone is at risk. The frontline workers more so at risk because of they're at a place where most people who come in there are sick. And we do know that now, even with the new strain of the COVID-19 vaccine, severity of symptoms are even more. And so transmissibility is also increased. So yes, they are at risk, but again, all they can do is increase how they implement these preventative measures in all facilities, in all places, churches, everywhere, have to adhere strictly by it because you could be next.
You talked about churches, and I would say, let me remain with you. He pointed it out that some imams or pastors are saying, is this the end of the world?
Oh,
the vaccination, because look, they said when you take the jab, they're putting a chip in you, and
I've heard all of that,
that.
with the 5G and all of that, so that we can all be controlled.
So please educate us.
So you see, now, one thing I'll first of all say is that this is not the first time. Even from time immemorial, from the polio vaccine, it's been rumored everywhere that, this was a way to get babies sterile so they couldn't, procreate. And, so it's been there. Every time there's something introduced newly, there are always things that come up as barriers. And one of them is just the myths and stuff about vaccines. So this has been going on. So like he said, which is very apt, is that, education enlightenment regarding the vaccine, not just other vaccines. So this is going to be lumped because we're still facing these barriers even till today with other vaccinations, and that's why our coverage rate is quite low for things like the pentavalent vaccine. But again, if we keep pushing it, especially for COVID-19, because of all the noise around it, like you said, is it 5G? Are they trying to kill us out and all of that? As a scientist, with my colleague here, this is still a vaccine as far as we know. We don't know anything beyond that. So it's a vaccine. What is it supposed to do? Help you build immunity to the COVID coronavirus.
Because I took up somebody who had this argument that is to reduce our population, but they are taking it over. They say, no, the one they will use over there is different from the one they will give us in Africa.
It's always been a thing. Even the Coke we drink.
Okay.
You know, let's think about it. If they wanted to really just wipe us out, there are lots of things that we all use that they could have used. They could have used a long time ago. So why wait for the COVID vaccine?
Okay, comrade, let me come to you because when these vaccines eventually arrive, a lot of people have said a lot because most of these products, the storage facility is a big issue.
Yes.
The code level where how you're going to store it. I don't know if Nigeria has enough. We have enough facilities to store this because they can't distribute them at the same time. And most of our rural communities don't even have electricity. So I don't know from the technician aspect, what do you think can be done?
Well, there should be constant lights. Well, we have a deep freezer so that this will be stored in the deep freezer. But if not, it's going to be a waste.
Because some of them are -70, you need to store.
And it's incredible. It's really, you know, he's mentioned, this is really true. You know, we're talking about electricity in Nigeria and power supply for a long time. So I'm not even going to go there, you know, but even what we're talking about is maintenance of a particular temperature.
Yes, exactly. That's what I'm saying.
Along the line, even during transportation. So again, I do know that the task force is looking into this to ensure that that whole cold chain is maintained even before the vaccines arrive. We just have to pray that they're ensuring that this happens across. And like I said, there are a lot of vaccines that already follow this process. But again, to this temperature that we're talking about and keeping it stable, we need to know how stable is this vaccine, and you know, what is it, labile, is it cold, what is the condition of the vaccine, so that we don't get a vaccine like what's happening with the wild type of the polio vaccine in some countries. Even though polio has been eradicated, we're now seeing that some of the vaccines, because of poor storage, are having the viruses reactivated.
Yes, it's true.
And you know, so you're inoculating people with, you know, reactivated vaccines, creating the problem again. So there's a lot to be done.
I think I'm getting sick now.
Yes,
exactly. I'm getting sick now to end the program because time is really not on our side. But this is becoming more interesting. I will play with you, gentlemen. Maybe next week we'll have to continue because this storage issue. This storage issue is a very big issue we need to look into, and we must look into it and see how possible it is to move from point A to point B without dropping.
You know, and just to chip in before we end, is you're saying that the COVID vaccine is not a supplement for the preventative protocols.
Okay, good.
I just have to re-emphasize that. Please, I think the best cure currently is wear a face mask, wash your hands. Physical distancing, as much as just, you know, and tell people, let people know, you know, even for my family, I mention it all the time. Don't think that because that you come to work with them all the time that they don't have COVID. So you go to work and you take off your mask. Wear your mask all the time, every time. All right. So that's just what I want to leave with you. And the COVID vaccine is just complementing the preventative protocols, but stay with the preventions.
Because some people had said that even after taking the vaccine, they still die.
Exactly. So you still need to.
That would be an issue we have to discuss. But because we must live for further progress to continue. Let me just, on the final note, you talked about awareness. From your perspective, from your own angle, what awareness are you having going on?
Yes, for now, I have been calling for meetings, educating people, educating my members, even to the rural areas. And I have in my agenda that maybe by February, I'll go into interior areas where they will be educated, so that if they are coming out to the city center, there must be masks, hand sanitizer, so that they will not be infected with this coronavirus.
Yeah, we have the, some people say it's a scorecard the NCDC released yesterday. But from what you've just said, this will keep on going higher because we laid down our guards
We did let them
during
guard.
the festive period. So is this alarming or what?
It is. It is. I think
alarming.
it is alarming, and then
Okay.
we just need to ensure these numbers just tell us that let's not stop. Let's not stop what we started. Let's remember how we were before. The good fear.
All right,
and keep up with that.
Gentlemen, I must say thank you very much for joining us. And like I said, like I requested, next week we'll hope to continue with this so we can talk more about this. It's a pleasure having you in the
Thank you,
studio today.
Patrick.
Yeah, viewers, we must leave for other programs to continue, sadly. But this thing is real with us. We must always put on our face mask, like I said, wash your hands regularly, or use alcohol-based sanitizers. It can never be enough. So please ensure you do this all the time regular, no matter how discomforting it may be. But it's better to be alive than to go 6 feet below because you want to enjoy yourself. Until we come away again next week, I say thanks for staying tuned and bye for now.